My name is Shashank Garg. I am an assistant professor of medicine at University of Arkansas for Medical Sciences. My co-authors include Drs. Jesse Shea and Sumant Inamdar, and Ms. Sheila Thomas from UAMS. Dr. Arvind Trindad from Long Island Jewish Medical Center is the principal investigator on this paper. Our paper is entitled Spatial Distribution of Dysplasia in Barrett's Esophagus Segments Before and After Endoscopic Ablation Therapy, a meta-analysis. Barrett's esophagus is known to be a pre-malignant change in the esophagus that can lead to esophageal adenocarcinoma. The risk of progression of Barrett's to cancer depends on the presence of dysplasia, and dysplasia can be eradicated to prevent its progression to cancer. However, dysplasia within a Barrett's esophagus segment is often focal and varies in location. Thus, a meticulous endoscopic exam is vital in detecting dysplasia. There are advanced imaging tools that can aid in detection of dysplasia, but despite the progress made in technology, dysplasia can be missed, leading to malignancy even in patients undergoing periodic endoscopic surveillance. Defining target areas of Barrett's that require a detailed endoscopic exam and tissue sampling was the primary motivation for this study. The outcomes were to define the location of dysplasia within Barrett's esophagus in treatment-naive patients and to define location of recurrent dysplasia after endoscopic eradication. We found that before ablation, dysplasia in Barrett's esophagus was more frequent in the right half of the esophagus as compared to the left half. After ablation, recurrence was more commonly found at the top of the gastric folds and was non-visible as compared to the tubular esophagus where it was visible more often. This information can be vital to endoscopists as we can spend additional time in these hot zones examining for dysplasia and to sample the tissue more aggressively. The results of this study should be used for targeted biopsies and should be compared to the current methods of tissue sampling to determine if the dysplasia detection can be improved. I would like to thank all of my co-authors for their hard work in making this project a success. I would also like to thank the editorial board of the journal Endoscopy for accepting our study for publication.